Hi viewers, I am Dr. R.K. Modi from the YouTube channel Medical Filters. Today my topic will be on post-COVID musculoskeletal complications. We have observed that daily in our day-to-day practice, patients come with joint pains, muscle pains, low back pain, headache, splitting type of pains in various joints off and on. But if we take the history of these patients, most of them had a past history of COVID infection. As you know, COVID started in 2020. Now it is 2022. In this span of 2 years, many people had these same symptoms and still it has not subsided. What are these symptoms? One is myalgia, second is arthralgia, third is neuropathy, fourth is myopathy, and fifth is Guillain-Barré syndrome, which is very rare. Now these symptoms are seen mostly in critically ill patients of COVID-19 admitted in ICU on invasive ventilators, having multi-organ failure, sepsis. Some are in hyperglycemia and on parenteral nutrition. So what is the mechanism by which these symptoms are persisting? SARS-CoV-2 virus, it acts on the ACE2 receptor. Thereby, the virus enters into the cells of the muscles, the synovial tissue, the cartilages. There they undergo viral replication. This results in a cytokine storm. These inflammatory factors such as cytokine, nitric oxide, oxygen radicals, they all cause hypoxia, decreased circulation to the local axonal factors, increase in the vascular permeability from chronic inflammation, causing vasogenic edema, bone resorption, and joint inflammation. Now let us take one by one. First is arthritis. Post-COVID seronegative polyarthritis following pro-inflammatory markers IL-6 and TNF. It is normally treated with low-dose steroids for a short period, etorecoxib, anti-rheumatic drugs, hydroxychloroquine. Sometimes tocilizumab also used to decrease the inflammatory response in these arthritic patients. Number 2, arthralgia and myalgia. 15.5% of arthralgia, more seen in female patients, and 5.7% is in arthralgia. Now you have come across many patients having new onset backache. These are due to release of pro-inflammatory signaling molecules such as C-reactive proteins IFN, IL-1B, IL-6 and IL-17, leading to muscle damage. Arthralgia and myalgia management is by giving non-steroidal anti-inflammatory drugs. Certain drugs such as chloroquine, ritonavir, ribavirin, interferon alpha and beta and corticosteroids are used. Even we can do physical exercises which can prevent the muscle atrophy, decrease muscle performance. To conclude, COVID 19 patients admitted in ICU on invasive ventilation and probation cycles had critical illness, myopathy, and polyneuropathy, and rarely they got Guillain-Barré syndrome. In case of uncooperative or sedated patient, the EMG, nerve conduction velocity, will give us the diagnosis. Management of critical illness, myopathy, polyneuropathy is to decrease the immobilization period and pulmonary rehabilitation and early mobilization. COVID-19 pro-inflammatory state. This causes reactive arthritis, muscle fibrosis, increased bone fragility, tendinopathy, and muscle weakness. Now, arthralgia precedes the onset of fever in a COVID-19 infection. The management with non-steroidal anti-inflammatory drug and rehabilitation is the treatment. Use of IFN beta and IFN alpha as a therapy can be associated with arthralgia and myalgia. Strong opioid use results in increase in hospital mortality. Prolonged steroid use results in osteonecrosis, reduced bone marrow density, osteoporosis, muscle atrophy, muscle weakness. Musculoskeletal symptoms, this persists even after recovery of these patients from COVID-19, such as fatigue, myalgia, low back pain, neck pain. Rehabilitation programs improve the above symptoms. Thanks for viewing my program today. Please subscribe my YouTube channel, Medical Filters. Thank you.